Well, welcome back. If you're going to make the chicken a la Vito we showed you in the last segment, you're going to need some quality chicken breast to throw into the mix, and that's for our healthy shopping segment. So, Joe, how do we find those good chickens that don't have all those bad things in them?
Well, the good news is that it's not as hard to find them as it used to be.
I know, that's true.
If you've ever been on one of those big food processing farms, and I have been, you will see chickens upon chickens all cooped up, literally strung together with IVs, okay? And those IVs feed them antibiotics, growth hormones. They want to make the chickens bigger, fatter, quicker, so they can get them to market quicker. They get more per pound for them. Their eggs, they increase the amount of eggs they can lay, and they make the eggs bigger, so they get more money for the eggs. And they also artificially inseminate the chicken. These are all things that God did not design. God designed a rooster and a chicken to make eggs together, okay?
Well, so, I also heard, too, that in these factories where they produce chickens like that, that the eggs, or the shell is so soft, they actually have to inject something in there to make the shell hard enough to,
that's absolutely true. And if you buy cage-free, omega-3 enhanced, farm-raised chickens, you have to give it a pretty good whack. Like when I made those pancakes this morning for the show and for my kids, I'm really beating on those because it's got a nice thick membrane to protect the chick if there was a chick to be born. That's the way that was designed to do. I think we have a graphic on this, Shirley, some bullet points on how to buy healthy chicken. Cage-free, never caged. That sounds like a redundancy, but you have to be careful. Sometimes they'll say cage-free, and what that means is that they let that chicken out of the cage for 5 minutes a day.
So they can put that on there and charge more.
They can put that on. You want never caged, okay?
Never caged,
that thing is just running around. Natural farm diet. What's a natural farm diet for a chicken? Bugs.
Rocks.
They eat little pebbles, for digestion. They drink water out of troughs. I mean, that's what they do. Let them do their thing. Naturally inseminated. We talked about the rooster and chicken. No growth hormones, no hormones of any kind. It's completely drug-free. Pesticide-free. Sometimes the grain of which they're fed which is not a natural part of their diet, the grain of which they're fed is grown in soil that also has chemicals in it. They eat that, we eat them. It's a bad situation. And remember this lastly, and our buying tip here, our shopping tip, biggest is not best. In fact, chickens were designed to be roughly so big. When you get these big, huge ones, when you see these chicken breasts like this, there's two things that are in them, growth hormones, and they're pumped full of water. Unfortunately, the government lets them put X amount of water into the chicken. So that kind of plumps things up, gives you a false sense of security. When you buy those processed chickens, that's a case where you're actually better off. I'll take grass-fed beef over a processed chicken anytime. Really? Now, if it's a free-range chicken, grass-fed beef, chicken 2 to 1, I think is a pretty good mix. It's not about the animal that you're eating, it's how that animal was raised. Well,
Dr. McKeever, chicken is a good heart-healthy food, though, isn't it?
It's excellent. Right.
Because it's low in fat.
It's low in saturated fats.
And I've heard that turkey is even better. I don't know for sure, but I heard that turkeys grow fast on their own. So even like processed turkeys that you buy don't usually have as much additives as the chicken. Do you know about that, Joe?
I don't know specifically. I would say fresh is always better. Fresh is always better. Interestingly, bison has less saturated fat and cholesterol than skinless chicken breast. Most people don't know that.
Really?
Yes. Well, if you look at a bison, it's a very muscular animal. So we had left off in the last break, though, promising to come back and talk about children's heart health. My daughter actually was born with transposition of the great vessels, which is one of those mysterious things that kids are born with, where their pulmonary artery and aorta are actually reversed. Technology saved her life, and she's leading a healthy life, so we're grateful for that. But the heart disease that we're talking about here with children is more the kind that is kind of self-induced. I recently read a study that said they're projecting, if we stay on this trend, that our life expectancy is actually going to start going back down again because of the childhood obesity, and that they're seeing a onset of type 2. They can't say adult onset because it's happening in kids. What are you seeing, Dr. McKeever?
Well, I'm an adult cardiologist, but we certainly deal with all aspects of heart disease, and we're very interested in what goes on in the children because they eventually get to us. And we do see the problem of obesity. We have done studies in local high schools measuring cholesterol levels in children in high school, and it's alarmingly high on average. And the Heart Association has gotten involved with all this, and so there's been a big push to try to get a healthy lifestyle, a healthy diet
healthy cafeteria foods and things like that. Yeah.
Well, and I'm so glad to see, you know, my title is a health activist, so one of the things we do is try and get information to people, and people like me, groups like me, it's taking effect. You know, you see Subway offering apples, you know, we see even McDonald's offering apples or grapes instead of French fries. It's a step in the right direction. Kids should not have, if kids having high cholesterol rating, that's a lifestyle thing. That's not a genetic thing, right?
That's right.
They're genetics at that point in time. So.
And I understand, you know, some schools now don't offer French fries and things like that. So that's a very positive move. You're watching Balanced Health, Your Body, Your Choice. And we have some more viewer questions to ask Dr. McKeever, as well as some questions that Joe has for him. So,
well, one of the things we wanted to ask Dr. McKeever about, because this is a show about integrated medicine, you know, taking some alternative approaches, nutritional approaches, combining them with conventional approaches. So, hypothetical situation. Patient comes in, you do a blood workup, he comes back with cholesterol of 238. Where do you go from there with this patient?
Well, you take a full history and examine the patient, and important in the history is what other risk factors does a patient have. If the patient has multiple risk factors, that cholesterol of 230 takes on more significance than if there are no other risk factors. Mm-hmm. But just a total cholesterol of 230 doesn't necessarily mean that the patient needs to be treated. What is that cholesterol made of? So you have to fractionate the cholesterol into high-density cholesterol and low-density cholesterol and other fractions, but those are the two main ones. And that's when we talk about HDL and LDL, those are the good and bad cholesterols. LDL being bad, HDL being good. If most of that 230 total cholesterol is made up of HDL, well, that patient doesn't need anything.
So it's about ratios, it's about big picture. I think a lot of people would like to know this. When you talk about, a lot of people know bad cholesterol is LDL. I'm going to give the street version of it, and you put it into the doctor's version. But low density lipoproteins, because they're lower density, have a greater chance of adhering to the walls and building up plaque. Is that why it's bad? Is that
yeah, in some way it adheres to the wall and it injures the wall, and then that sets up an inflammatory response, and then the natural plaque formation begins.
So when we hear the term calcium deposits on the inside of these arteries as it relates to coronary disease, are we talking about calcium, or has that plaque calcified? How does that?
That's a great question. The plaque has calcified. What happens when a plaque gets deposited in the body, in the blood vessel, the body responds to that by depositing calcium in the plaque.
It's supposed to do that, really.
Yeah, it's some kind of defensive mechanism. The importance of that is that we now have some technology that can measure calcium in the plaques and diagnose problems before there are clinical results of those
That's
problems.
huge. We have about 45 seconds to break. Triglycerides. We know they're supposed to be low. What is a triglyceride, and what's a good number for us? And I know it has to also relate with the other ratios of the cholesterols as well. But we just know our triglycerides, but what are they?
Well, triglycerides are fats in the blood, and a large component of them are due to what we exogenously take in. So if you eat a lot of fat, your triglycerides are going to be high. If you have certain illnesses like diabetes, your triglycerides are going to be high. High meaning above 145. So we want the triglycerides to be below 145. We used to think that triglycerides were less of an issue. They're still an issue with heart disease, and they need to be addressed.
In a blood workup, when you look at insulin levels in blood, are you able to, is that a predetermining factor? If you see somebody has a high insulin level at a young age, just very quickly, is that a factor for heart disease?
Yes, it may be. Insulin seems to be injurious to the wall of blood vessels. And
interesting.
We'll talk about that more next show.
On another show, yeah. Well, if you'd like more information on Edward Heart Hospital, log on to Kylia.com or TLN.com, and we'll be right back. Stay with us.